Welcome to Mental Health Momentum, a Silicon Slopes podcast. I'm Dr. David Morgan. I'm a licensed psychologist and the Director of Mental Health Awareness here at Silicon Slopes. And on this podcast, we talk about mental health issues in business and beyond and look for solutions. And I'd like to introduce you to my guest today, Christy Kedding, like Keds.
Like Keds.
Yes, not Keating, like Keds. Let me tell you a little about Christy. She's a licensed clinical mental health counselor and the founder of, okay, I'm going to say this wrong, Illumin Therapy, where she helps high-achieving, quietly ambitious professionals recover from burnout and return to a more sustainable, self-honoring way of being. Her philosophy is simple but powerful. You are not a problem to be fixed. She doesn't see therapy as a place to diagnose, label, or categorize, but as a space to come home to yourself. Her role is to help clients find clarity, relief, and a path forward that aligns with their values, not anyone else's expectations. She uses feedback-informed treatment because she believes that what gets measured gets managed, and is committed to honest care, including referrals when someone else's needs would be better met elsewhere. With over a decade experience in mental health, Christy has supported clients across a wide range of settings, from residential to IOP programs to trauma recovery and substance use treatment. She holds a master's in professional counseling from the University of Phoenix and a bachelor's in human development and family studies from the University of Utah. Her ongoing training includes sensory-motor psychotherapy, brain spotting, EMDR, ACT, and multiple trauma-informed resilience building modalities. Usually I don't know what half these acronyms mean, but I do know what those mean.
But you do know
I do know those.
Good. The audience doesn't, but that's okay.
That's right. We'll explain. Outside the therapy room, nature is her sanctuary. Whether hiking, backpacking, or backcountry skiing, she draws inspiration from the rhythms of the wilderness, where resilience means knowing when to rest, when to stretch, and how to return to center. She's also an introvert, a lover of travel and culture, and a deep believer in human adaptability, in our ability to grow, reconnect, and move forward with greater self-trust and steadiness. Christy, thank you for being here today.
You're welcome. Thanks for having me.
I am excited to have this conversation. We were talking earlier about how we get a bunch of different guests on this podcast, but not super often that I have a fellow mental health professional. So EMDR, ACT, those are types of therapies that can be done for different types of things. That's what all those acronyms mean. Yeah. So tell me about your background interest in mental health. How did you end up to where you are now?
Essentially, I started going to therapy when I was 14 because of some family things that happened when I was younger. And kind of throughout my life, kind of kept going back in and out, in and out. When I graduated with my bachelor's degree, I had a mentor. Her name was Lisa. I worked at a prevention program. So I was working with at-risk youth. And eventually, after a year or so, she said, I think you'd be a really great therapist. And I turned to her and I was like, I've been to therapy. I'm not going to be a therapist.
Can't turn the tables.
Yeah. And she was like, I think it would be a good career for you. So then I entered into school, and the rest is history. Now I've been a therapist for, going on 12 years now. So
I think there is, you talk about saying, well, I've been to therapy, so I couldn't be a good therapist. But I sometimes think those make the best, just because there's a level of kind of just awareness and authenticity of knowing what it feels like to sit on the other side of the desk or sit on the couch or wherever it is, right?
Yeah, absolutely.
Yeah. You ended up in like you said, it wasn't what'd you say, a treatment center? The place you worked where she said you'd be a great therapist?
It was a prevention. So it was a nonprofit.
Center. Right.
Yeah.
So how did you end up there? Like what kind of led you into that direction instead of like investment banking or something like that,
Yeah, well, I got my degree in human development and family, human development and child family systems, something like that. I can't even.
It was a long time ago.
Yeah, it was a long time ago. And essentially, when I was in college, my mental health was really spiraling at the time. So I was jumping around from career and different,
majors.
Majors. Thank you. And finally, I just went in and I was like, I just need to graduate. And so they were like, this is the quickest way.
Sure.
And so I ended up with that degree, which, I'd always wanted to work with youth and kind of be in that sector. There was always a calling for that. But then I got the degree, and then that led me to finding a job within that.
That is interesting how you'd always wanted to do that, but then you kind of fell backward into it through ending up talking to a counselor at the university and them saying, you got to do something
You got to
quick.
do something. Yeah.
They don't like us to stay forever in college, do they? Yeah.
Yeah. I was 5 years in. They wanted me out.
One of the things that I like to talk about or ask guests about is just about misconceptions about mental health, because there are so many misconceptions, as you know, being in the business. And I think that's one of the things that fuels maybe a resistance to seek help. I was talking with someone, I can't remember how long ago, but she was explaining her situation, and she said she had been diagnosed with this condition like 20 years ago. And she said, so therefore I can't do this, this, or this. And I said, well, what do you mean? Do you still have the diagnosis? And she said, what do you mean? I said, well, do you still have those symptoms? She says, well, once you have a diagnosis, you always have a diagnosis. And I said, who says that's true?
Yeah.
Symptoms change, right?
Yeah,
we change, and we differ.
Yeah.
And she was shocked to learn that the diagnosis she was given 20 years ago might not be valid today. Now, it still might be valid if she still had the same symptomatology and it was affecting her life in the same way, but it wasn't as we got to talking. And she was shocked and relieved to know that she didn't have like this, almost like this brand or this tattoo. So just in your work in the last decade, have you come across common misconceptions about mental health or just things you see in society at large?
Yeah, I mean, I think one of the misconceptions is that I see often is that there's an end, like that we can reach, and that then our mental health will be good. And I often see that then kind of blocks people from maybe entering back into therapy or not reaching out in the first place.
Right.
And another misconception that I often see is kind of a similar thing that you were just speaking to, is this idea that I will be diagnosed. And I often think therapists, some of I guess me and my colleagues, we don't necessarily see the world through the DSM.
Right.
And the DSM is the diagnostic.
That's the big book of diagnosis. Yeah, exactly.
But I often see the person in front of me that I can look at, qualities and characteristics or temperaments, of who they are. So maybe someone who's an introvert or shy or timid versus someone who's gregarious and ambitious. I don't see that as a label or a diagnosis, but I often think sometimes they are worried if I show up as an introvert, she's going to say that I have social anxiety.
Exactly.
And I often see that therapists, we don't think that way about our clients. But I see that as a misconception from society is I'm going to go in and they're going to tell me all these things. And I think if you're thinking that's a really scary thing. Right. And it's going to hold you back from actually going into therapy versus if, we just kind of talked about it and destigmatized in a way of, we are just human and we have these different quirks and personalities and drivers and values. And let's start there and see maybe how they're working for us or maybe not working for us, and then how to blend that into moving forward in the way that we want.
I love that. And I wish I could turn back the clock and we could just get rid of diagnosis altogether.
Yes.
Only because diagnosis is really just, it's a tool that mental health professionals have to be able to concisely speak about a complex phenomenon, right? And so instead of listing 9 different symptoms, we can say this person has major depressive disorder, and between you and me, we know what that means. And so that, we can facilitate treatment or communicate effectively in that. But I don't think it was ever designed to be a permanent label, and it changes too. Yeah. In the next iteration of the big book of diagnosis, the DSM, there's going to be different diagnoses. There's going to be ones that have changed. There's going to be ones that are missing. Yeah. It changes all the time. And so I think when people understand that not only is it not permanent, but it's really not even a label unless they want to self-apply. And I think that's a problem now too, is that you can go online and take a 5-minute quiz that'll tell you every diagnosis you have, which is probably a bunch of hooey in the first place.
Yeah. Oh, I could diagnose myself with everything if I wanted to.
That's so true. I remember taking my undergraduate abnormal psychology class where you learned about all the different diagnoses, and I'd come home every week saying, I got that. Something new, something new.
I think I'm borderline this week.
Exactly.
Yeah.
Well, and that's the other thing people fail to understand about diagnosis is it's not only a matter of meeting the symptom criteria, but it also has to be something that impacts your life in a significant way.
Right.
It's got to be getting in the way. And so you might have someone who has some anxiety symptoms. Maybe they don't like being in social settings, nervous, introvert, like you were saying, you're just a self-described introvert.
Yeah.
And the difference between you having those feelings and someone who might be diagnosed with a condition is that despite your introversion, you got in a car, drove down here, are sitting in a podcast booth, right? And so it's not impacting your ability to do things in a significant way. And that's the other thing people miss is they'll say, well, I've got these symptoms, therefore I have this condition, but that doesn't necessarily hold true.
Right.
Yeah.
Yeah.
Yeah. That's why you have to let mental health professionals diagnose. Soapbox moment. Don't self-diagnose. I mean, come to Christy, come to me if you want to get a diagnosis, but don't self-diagnose. What do we do then? So these misconceptions create stigma. And what do we do to decrease the stigma? I'm not looking for the great solution here. What are some things we might be able to do? Yeah.
Be curious with ourselves and be curious with others. When we think about like workplaces and when we think about our home life, we are very quick to, and it's a part of kind of our evolutionary being of like to judge and to compare. But if we can actually step back and be curious, and instead of creating another stigma by being and saying, I think the hot term he's a narcissist.
Right.
It's like, well, are they?
Right.
Can I get curious about that? And I think if we can slow down and reflect and be aware, I think that can really create a different type of destigmatization for mental health.
I love that. Just it aligns somewhat with just this idea of critical thinking and saying, let's just take our time before we make decisions. Let's gather data, and then and once we have enough, then we can see where that points and where that leads. But so often we just make assumptions based on almost zero data.
Yeah.
And in my experience, and I've done the same thing my entire life, and I think it is partially human nature.
Yeah.
And I found that when I make those assumptions, I'm almost universally wrong. When I get to know a little bit more about the person, for years I did forensic psychology work and worked with a lot of people in the criminal justice system. And so before they would come see me, I would get their file, which was full of police reports and judgment and sentence and those sorts of things. So I saw the things they were convicted of. I saw the things that that were reported by the police that they did and read victim testimony and stuff. So I could develop a very different opinion about that person just based on that. But I always waited until, well, not at first, because at first I had bad judgments. And then I learned, because the person would come and sit down, I'm like, oh, well, this person isn't as strange as I thought they would be or as bad as I thought they would be. And then oftentimes they were very nice people that had just gotten themselves way in over their heads with some stupid decisions. But yeah, gathering more information, being curious. I love that.
Yeah. Because I think this stigmatization comes from when we're quick to judge, quick to put a label on it, versus if we slow down and be curious, it can really open up for another discussion of, no, I'm not, like how you were saying, I'm just shy. I'm actually not socially anxious. And it's like, oh, okay. And that's a part of mental health too, learning ourselves and who we are and how we show up in the world.
With your own clients, do you encourage them to be self-curious? I mean, is that a thing, like to have them introspect on their own judgments about themselves?
Oh, yeah. Yeah, that's a big thing that I work on in my office, is I often have clients who are highly ambitious, highly caring. So it's a part of their core value is to be relationship focused, but sometimes they lose themselves in that. And then with that, they have a lot of shame. And so a lot of my work is, how do we get curious about, who you are and how you show up. And some of that shame can, lead into burnout and can lead into disconnection from self, because they tend to start to think, well, Kelly down the street can do it all. She seems to have it all together. And so then I help them slow down and say, but who are you?
Right.
What differentiates you from Kelly down the street? What are your gifts? What are your strengths? And, through that kind of process, a lot of my clients are able to connect to, who they are, or maybe parts of themselves that were seen as, not good or wrong growing up. Because a lot of my clients are introverts, are highly sensitive themselves. And, along the way, that kind of became not a good thing.
Right.
They felt like they had to be more extroverted. They felt like they had to have it, all together in, certain ways. And so having them connect back to who they are and really know, like, oh, it's okay that I might not want to go out on the weekends. That means nothing about me versus, but they start to label themselves as I am bad, or I'm not as good as that person. I'm weak. And so doing that kind of self-reflection, that self-curiosity allows them to really tap into, no, that is okay that I'm like that.
Yeah. Well, and I think another one of the stigmas or maybe misconceptions you talked about, a lot of your clients are highly successful, and on the outside, someone might look at them and say, oh, this person's got it all together. She's got everything going on. She's a successful businesswoman or successful whatever. But they're still struggling with things. And I think we're finally getting to the point where it's okay to acknowledge that in society, but there still is, especially kind of in tech or entrepreneurship, this feeling of, I just have to do it all. I have to do it all, and I can't. And Steve Jobs never had any problems, and Bill Gates never had any problems, or whoever their model is, Jeff Bezos, whoever it is, and helping them understand and break that stigma down, because that self-stigma can be very detrimental as well. It adds to the problem that they already have.
Yeah. The most common word I hear from my successful men who are CEOs or entrepreneurs is the word blah. I have it all, on the outside, I look like I have it all together, but inside I feel blah. And so there's this tension point that they're constantly feeling of the blah, but then I should be happy.
Right.
Or people think I'm happy. But inside there's this feeling of, the disconnect. And for a lot of them, it's because they kind of not lost their way, but they lost their sense of self along the way.
Yeah. And we don't do anybody any favors by perpetuating that experience. If we feel blah inside and then still try to look perfect on the outside, that doesn't help anybody. I think acknowledging the blah is not a bad thing, especially if you're in a position of influence, to be able to say, I feel like this at times. And then everyone else goes, oh, well, I feel like that too. And then it kind of normalizes that experience, because it's not a like a deviant experience or anything. It's kind of normal. Yeah. A lot of us probably feel a little bit blah on the inside.
A little bit blah. And we also work on this idea of the happiness, because I always tell my clients, happiness is an emotion that's coming and going, just like all the other emotions. And if we're trying to achieve that, because that's usually the thing they want. I don't want to feel blah anymore. And I'm like, well, what do you want? I want to be happy. I'm like, what is this illusion of happiness?
Right.
And so I think even just working within that realm of it's okay to feel blah. It's okay to want to be happy at moments.
Right.
But we also have to understand that happiness is just like all the other ones. They come and they go, and it's not something that we can just achieve and then we are set for life.
Isn't that interesting that we do kind of think that way, that we view these things as like these end goals, like a permanent state. But what emotion for any of us is permanent, right? I mean, even people that struggle with significant mental health issues, when I talk with them, I press them on that, and they say, well, I'm anxious all the time. And I'm like, really? Let's talk about that, because my guess is, and maybe they have a certain degree of anxiety all the time, but to say their anxiety is a level 10 all the time, that's just not true. It's going to wax and wane throughout the day. And it might just go in between 8 and 10, but it does create that idea of flow, right? And an idea of variability. And once we can accept that with our emotions, then when we have the happiness, we're like, this is fantastic. I feel happy. And when that happiness isn't at level 10, then we don't think we're broken or that we've done something wrong. And what am I doing wrong that I can't have that level 10 happiness all the time? Because maybe that's, even just me saying maybe that's not achievable shows my bias too, right? I should just say conclusively, it's just not achievable, right? It's just, it all waxes and wanes. Let's talk about the difference between, I imagine you started out doing kind of mental health counseling, but now you're doing kind of high performance coaching as well. Can you talk about the difference between coaching and counseling, just in your mind? I think a lot of people out there are a little bit maybe confused about that.
Yeah. So with, the mental health counseling side of things, my clients, they come to me when they know things need to be different. And I feel like it might be some underlying things that I've not addressed. So for my clients, it's sometimes anxiety or depression or trauma, and a bit of their functioning is starting to disrupt or their relationships. And so they kind of know there's this aspect that they need to, address their mental health side in that way in order to move forward. With high performance coaching, where I'm still taking the same self-curiosity, and we're doing a lot of values work of, taking where they are now and how do you still balance that wanting to be successful and ambitious with, what are your priorities, what are your values, and where do you want to move to? Where do you want to move to, and how do you want to get there?
Right.
So I guess coaching would be, knowing my mental health. There's not something that is holding me back in the way that we would give a mental health diagnosis.
Right.
So they're not meeting criteria in that way, that it is anxiety or that it is depression, and that it's more so I want to be able to perform at a high level, but I also don't want to risk maybe falling into some depression, into some anxiety.
Almost sounds like a different starting point, like those who traditionally seek mental health counseling are probably at maybe a lower point in their life where they feel like they're almost in a hole and they need to kind of get out of that. Whereas coaching is more for people who maybe don't feel like they're in the hole, but they want to figure, how do I get higher, right? How do I improve upon the skills that I have already? It gets often confused as well. And I think especially with the proliferation of life coaches out there, it can be tricky. And if you're seeking mental health counseling, you need to be careful about who you go to and whether they're credentialed and licensed, and look at their training and things like that. Because like we were talking about earlier, there's some there's a lot of subtleties in mental health intervention that not only do you get trained on in schooling, but then you just learn over time, right?
Yeah. No, and that's a great analogy. Like a lot of my mental health clients are saying, I feel like I'm drowning.
Yeah.
I'm juggling all the plates. Like those are the ways that they describe their internal world. And it's this sense of, I can't keep going at this. This is no longer sustainable. With my high performance coaching clients, it's more so, I want to get here.
Right.
And how do I do it in a way that's sustainable? So it's a different starting point, like you said.
Want to get rid of the blah.
Yeah.
Right. Yeah, exactly. So what do you think? So people out there who are saying, well, what can I do? What can the average person do to just address like their own mental health? Whether they're blah, whether they're in a hole, do you have any like go-tos that you do for your clients that you find helpful?
Oh, I always tell my clients that healing and self-care is unsexy. It's not what we tend to see on social media, the bubble baths and the day at the spa.
Right.
A lot of it is the small, consistent things over time, and they compound. When I think about my own mental health journey, when I see a lot of my clients, it's 14, 15, 20 years of small compounding differences. And that can be taking an orange to work when you're used to not eating lunch. That could be going outside on a 2-minute break to get fresh air instead of just pounding through, the work day. It could be turning off your phone at night or listening to a 2-minute meditation in order to fall asleep versus scrolling. And for so many of my clients, it starts with a very simple thing. I'll encourage my clients. I'm very committed, action oriented. So I'm like, what's one thing you're going to do this week? Yep. They're like, I'm going to go take a 5-minute walk. And that 5-minute walk turns into a 10-minute walk the next day, which then they're in this kind of different way of being, different way of feeling, different way of seeing the world. And then, I'll get calls from clients 3 years later that like, remember that thing I said I was never going to be able to do? I'm doing that thing now. And I'll write back, I'm like, well, tell me how you did it. And they're like, well, this thing led to that thing, which led to this thing.
Yeah.
So we never really see how such a small thing that our brain thinks is insignificant really actually does add up to making a big difference.
Yeah. And that's the solution, and it's also the cause in many cases too. It's just the compounding of small things over time that usually gets us into the holes that we find ourselves in, or the blah that we find ourselves in.
Yep.
And the exit plan is the exact same thing of just these small things consistently over time. And I love that, because that's the good news, because all of those things are so doable.
So doable.
And if we can convince ourselves that through those small things we can achieve the change that we want, then there's really nothing that can stop us, as opposed to looking at this huge mountain that we think we have to climb in 2 hours and it's going to take 20 years. And,
or be rolling all the rocks up as you're doing
exactly.
it. We don't have to do that.
I love that. I love that. Mental health change is unsexy. Unsexy. It takes a long time, but when you get it done, it's amazing.
Yeah.
And the changes are remarkable.
Yeah.
Wow. Aren't you glad you changed your major and found yourself in this position? Yeah. Who knows where you'd have been?
Yeah. I know.
Well, Christy, it's been a delight to talk with you. Thank you for sharing your insights and your professional expertise as well. If people want to find you online, where do they go?
They can go to illumentherapy.com and reach out there.
Excellent. All right. Thank you, everyone, for listening today. Remember that change starts with you, and together we can increase our mental health momentum.